Welcome back to Unfiltered Unspoken. Where we are going to continue to share life experiences of others in hopes that someone will start the journey to healing. Today we have Dr. Ann Katona Linn, and we're gonna again, she's gonna introduce herself, and as you know, Sid is gonna kick off the first question. Thank you, Dr. Ann. How are you today?
Hi, I'm doing great. So great to be with you tonight.
It is an honor.
So just to kind of tell you about myself, I am an educational consultant and coach, and I help schools and education leaders create safe, supportive, and successful environments through engaging everybody. So youth, family, teachers, community partners, whoever those people are, and really looking at what do they have and helping them to integrate things and making sure that they're kind of working smarter before they start adding new things. And especially when we talk about trauma sensitive, because that's a lot of what I do. People can get overwhelmed just with too many different initiatives going on. So sometimes that's the first thing that I do. And then I also do training and coaching. And I started off, my training was a special education teacher and a behavior analyst. And I really got into the field because I had my own childhood trauma. And so my childhood trauma really led me to the work that I do. And then I just recently, in the last 7 months, 6 months, wrote a book kind of sharing my story. And so I've taken all of my own personal experiences with my own trauma as well as family members. I've had several family members. We actually just lost a nephew in May of this year from a drug overdose, which I was very involved in his care and just guiding his parents along the way because of all of my experiences and what I've done over the years. And so that was tough. And it's just, I try to be an advocate and help people navigate some of the challenges of getting services, getting support. Who do we talk to, the complications of mental health and substance use disorder. So kind of all those things together. So I have my own business now. I have worked at the state and I have my own business because I want to make sure that my voice can be kind of pure in terms of I'm not influenced by anyone other than my family and my sphere of influence. So, which is, when I share my own story, I want to be able to be vulnerable and share what I've learned and share the difficulties because that's the way I can help others grow. So that's kind of me in a nutshell.
Wonderful. That was a very good introduction. Thank you.
Thanks.
All right. So we always like to take it from the origin, from the beginning. And we do know just from listening to your introduction that you did experience some childhood trauma. So what was life like, growing up? What was your family structure like? How was that for you?
Yeah. So I am the youngest of 7 children and I have 6 older siblings. They are in an 8-year gap. So 6 kids in 8 years. And then I'm 8 years younger than the youngest. So I was obviously not planned. My dad used to call me the Legion baby, which I was like, never really knew what that meant. I think maybe it was because he had a couple beers and came home and was feeling amorous or something. I don't know. But anyway, so I was born in 1966 in kind of a central Pennsylvania, sort of not rural, but small town, kind of a group of small towns. And I thought I just had like the best life, when I was growing up. And when I was about 4, so even before that, I had, my older siblings really watched me a lot. So they would take turns babysitting me because my mom was working at that time. Obviously, she had to with 7 kids. And so luckily she worked at an amusement park at their swimming pool and ran their swim program. So all of her kids were able to come with her. And I was only 2 months old when she went back to work for the summer. And all my older siblings had to take turns watching me. So that was, kind of looking back, not the ideal for them or for me, just because, I am pretty sure that I wasn't, the best thing that they were going to be doing that summer. So I know they loved me, but I felt like I often felt like I was kind of a pain in the butt and didn't necessarily know why. And really, again, I think part of it was that we were just a family that, and like many families, and this is in the late 60s, that we didn't talk about stuff. We didn't have kind of deep conversations. We kind of just went on with life and did all of our own things. And yes, we were involved in church and Girl Scouts, and I played basketball, and I, was involved in all kinds of different sports, swimming, diving. And, but we just didn't talk about stuff. That was kind of the thing back then. And then when I was 4 years old, my oldest sister, who was going for she was at nursing school, and she was having kind of like some event going on. And I think we were taking a dress to her, something we were taking to her. And there was a lot of traffic. And I remember all this. I was only 4 years old. I remember all of it. There was a thunderstorm. And this is 1970. We didn't have child safety laws. Cars didn't even have seat belts. They had bench seats. So, for the older people, they can remember it was bench seats. And so it was my dad was driving, my middle sister was in the middle, and then my mom was in the passenger side. And I guess there was a thunderstorm that I didn't know if I was afraid of thunderstorms before, but I went and sat on my mom's lap. And there was a lot of traffic, and there was a garbage truck lost a bunch of stuff on the side of the road. And in that, again, kind of creating more traffic, we ended up hitting into the back of a car right in front of us. And I went face first through the windshield. So I had some pretty significant damage all up in here, through my nose, my cheek here. They did a pretty good job with the plastic surgery, but it was pretty significant. And like I said, I remember all of it. Like it's, I'm 57 now. So this is like 53 years ago. It's crazy that I can still remember all of it. So it kind of like shows what trauma does to you. And I remember them taking me in the hospital. And well, first I even remember my mom she was a lifeguard and she taught life saving. So she was really good at first aid and being calm. And she had to hold the skin on my face because I was bleeding, and a big portion of skin was taken off my face. And so when they got to the hospital, I remember the nurses and doctors kind of pulling me away from my family. And then at the time, they wouldn't allow families to stay with you in the hospital. So they were only able to visit. My dad ended up going home, but my mom and my oldest sister were only able to visit for 2 hours a day. And what they would do is they would put us in this little red wagon that they would ride us around to really distract us so that our families could sneak out, which, again, further traumatized. I remember my roommates. I remember everything. I mean, I remember details about the room, about the experiences, sounds, sights, smells. I remember waking up and getting a shot in my butt, which I'm guessing was antibiotics. I remember the doctor's name, my roommates' names, everything, all these little details. It was a really pretty bad experience. Again, my mom and my oldest sister would come visit me during those 2 hours. And they said that when they would leave me, after they left me, they would go down in the lobby and they would cry. And I didn't know any of this. So, this was a pretty traumatic experience. And then when I got home, as I shared earlier, we just didn't talk about stuff. Like I said, that's what we did back then. And we still do that now in so many ways.
Yeah.
So sad.
I would agree. So can you tell us some of the traumas that you experienced, like some of changes after the accident?
Yeah. I ended up with full blown PTSD, though that wasn't ever, it wasn't diagnosed until I was much, much older. But I remember all the panic attacks. I remember anytime I felt uncomfortable in a car where someone else was driving that I wasn't comfortable with, like my sister, who's 8 years older than me, who's an awesome sister. I felt so bad. I feel bad now when I think about it, but she doesn't even remember it, I don't think. She had her permit, and my mom was going to let her drive home with her driver's permit. And I remember she pulled over on the side of the road. And when she pulled over, I got out of the car and I was like, there's no way. There's no way. And I was not an outward problem behavior kid. I didn't express my emotions. I was way more internalizing. So when you see me, when I think about me having a panic attack, it's like there was nothing I could do to control it. So, there was all of that. And then my symptoms actually stopped when I was around 14. Again, later, I realized that 14 was when I started drinking because it was acceptable, growing up in kind of a coal region area, and it was normal for us to drink, and it was kind of a badge of honor. So I was self-medicating and didn't really know it. So those were some of the things that really happened in my teens. I think one of the big things is that I always felt like something was wrong with me. So I was constantly trying to prove myself. I was constantly trying to, dated the captain of the football team. I was very involved in student council. I played basketball. I was, I was very involved in a lot of things and tried to put on a good face so that people wouldn't know what was really going on with me.
And did your accident kind of change the dynamic in the home? Because already kind of as the baby, your siblings are going to take that in different ways, different doses. But I'm sure at that time, you needed more help than usual. So how did that kind of change the dynamic in the home, and how was your relationship with your siblings?
Yeah. So I think because I did have those emotional issues, that I felt like my family thought I was being spoiled, because my mom probably especially would want to shield me from things because she knew what I'd been through. And I mean, she saw it, she was there, she experienced it. And really, they all experienced trauma too. And so, again, you don't know what you don't know, but especially when we're talking about like a child and we think of, oh, they'll get over it or whatever, they won't remember it. And because I did, I think it's when you see behaviors that you don't understand, you kind of think of them as being annoying. So I'm sure, I always felt like I was a pain in the butt, even if they didn't necessarily say that to me or really even treat me that way. In many ways, I just kind of felt like I was maybe spoiled in some ways. And though I really was so needy in relationships because, again, I thought something was wrong with me. So I think that the dynamics, I know my dad had PTSD, and he had already kind of had some trauma I've now found out as an adult that they had some trauma in their family, and he always blamed himself for the accident. I mean, I remember, he said that multiple times throughout our life, yet he couldn't manage his own emotions. So he could never support me for sure. And, so I think that I was always trying to get my dad's attention. So I learned about sports even more. I was a tomboy, but I just really was focused on learning about sports and watching sports and, doing all those things because that's what my dad did. And that's how I was able to spend time with him. So, he blamed himself. He said that, but he never, again, we didn't get counseling back then, unfortunately.
So you said it also caused issues in your relationships. You felt a little needy. Can you tell us like the needs that you felt in your relationships?
Yeah, I was really insecure. Again, it didn't show up that way, but I was very insecure with people with guys especially, I just kind of wanted that attention. And I wasn't outwardly kind of like flirtatious or promiscuous. I was just, if I got into a relationship, I would like cling on to them, like, really significantly, because it's like, okay, this is going to be the one, and I just really, I needed to feel safe. And that was kind of, I was looking for people, specifically guys in relationships who would make me feel safe. And yet the guys that I chose were not always the ones who were good candidates to be a safe, relationship. Um, so those were kind of some of the things I think early on, especially, I just uh, didn't have great relationships, and they didn't last very long. I had one that was about 4 years that was in high school, but after that, that was when that really hit me as well. Like, something's wrong with me, because that didn't work out. That's when I think I became more needy after that. And I also kind of fell apart at that time too, in my early 20s, because I didn't have a lot of the structure that I had had before, and I wasn't around my safe people. So it made it more difficult. So I think I self-medicated more. I was looking for love in all the wrong places, like the old song. But those were kind of some of the things that I think that happened, which in my early 20s, I was actually raped by a guy who I had dated previously. And he worked his way into my apartment, and it was like a Saturday night, which I was home sleeping, and which normally I would have been out or something. And I was home. I don't know why, but he came, and he just talked me into opening up the door for him. And he actually had his cousin with him. And I think he wanted his cousin to join in, but his cousin was like, no way. And so I didn't even realize what happened. I thought, again, I must have done something to deserve this. And then 2 nights later, we were out at a club, and because of like Monday night happy hour at this place we usually go to. And I had a panic attack, and I was like, what the heck? And, when I realized, I was raped. And it was pretty, that was pretty significant. And I remember just going to counseling and saying, oh yeah, I had PTSD as a kid, but I got over it. I didn't. So those were kind of some of the earliest relationships. And that really continued into my early 30s. And then I actually went to like a singles retreat, just to I was living in Florida at the time. I had previously gone to school in San Francisco, so I was out there for 6 years. And so being in Florida, in the Tampa area, actually, and I went and just had some really major awakenings, and decided I was not going to date at all, and so I spent 7 years of just not dating and focusing on my own healing, because I wasn't good in relationships. So I needed to just learn how to really love myself, and to focus on my own healing before I could love someone else. So that was kind of my thinking. So that was at 33 years old.
Wow. And did you ever, I guess, pursue any legal matters and with the, incident with your ex?
Yeah. So I did file a report. I was in San Francisco at the time, and there was no way I was going to press charges, because even filing the report was torturous. And, and my family, again, we had historically just not talked about stuff like, let's move on. Let's, get past this. And so I was like, I'm on the complete opposite coast. There was no way that I was going to be able to, count on my family to be able to support me through that. And again, it just, I didn't see anything wrong with that. And I don't blame them. They just didn't have the capability to be able to do that at that time. Again, they were traumatized as well. So yeah, so I couldn't press charges, but at least I filed a report. the whole Me Too movement, again, for me, this is 30 years later, and I've, dealt with it and really healed a lot. It's just, I can relate to that, to the whole Me Too movement when I hear about things and people are like, well, why didn't you say something? It's like, you have no idea, because you're going to get shamed. You're going to get, attacked. You're going to, people are going to say things about you to you. And I had people say things to me who were friends. And it's just like, there's no way. I can't even imagine. I wasn't in a good place to do anything with that. So,
Wow. So can you let the audience know what kind of traumas the rape left? And also I want to know, did you ever see him again after the rape? Like, did he disappear? Did he
mm,
say something to you? Were you able to confront him?
yeah. Yeah. Great questions. Obviously, just the trauma of the rape, feeling like, it's such an intimate violation, and it's just such a violent thing that I think it's one of the ultimate invasions of who we are as a human being. So just that trauma that I already was very insecure, really adding to it. And then me thinking that, again, I dated this guy, so I must have done something. It's like, well, I already had sexual relationships with him. So, what's wrong with that? And, again, that's kind of the stuff that I went through and really doubted myself. Though I didn't, he would, if I would ever see him, I would avoid him. He did call me and even moved, I think, to Atlanta, and he kept on trying to keep in touch and was just saying, like, I've changed, I'm a different person, I've, I'm not who I used to be. And I'm like, I didn't, the one good thing is that I didn't care that I was done. I, he was not going to be in my life. And so that was a good shift for me, for sure, at that time.
That's great. That's great
Yeah.
that it didn't really have to go any further than it did.
Yeah.
Even though that was far, but
Yeah.
at least after
Yeah.
that you
Yeah.
were able to kind of
Yeah.
pick
And the
up
police
and
actually
get
called
moving.
me and they said, you sure you don't want to press charges? Because there have been other women. And I'm like,
Oh,
yeah. And I actually have good friends who I know were also raped by him. And it, again, and they didn't even file a report. It, again, it's just, it was the time and the lack of support, women didn't, especially if we knew the person. It just, date rape was not prevalent the way it is more so now.
exactly.
It almost sounds like he was raped too. I mean, it sounds like his habits, but I mean, we can't say, but
Right. Like he could have been a victim of abuse in some way.
yeah.
Yeah. Yeah.
Absolutely. Now, what I guess for anybody wondering, since you had mentioned it, what was the singles retreat like?
Mm.
What did you learn? How was it for you? The
Mhm.
experience of it all. If somebody's interested in that, what kind of takeaways do you have about it?
Yeah. This was like, it was kind of crystal clear. It was 1998. I remember it clearly. It was a choice singles retreat, kind of a Christian retreat, and it was for singles. And I'd been off and on kind of going to church, but I felt like I started going back to church because I felt like I needed it. And again, I didn't exactly know what was going to happen. I just felt like I needed to do something because I just wasn't happy with who I was. So this retreat, it was an entire weekend, and people basically shared their stories of how, they've been through something, they overcame it, and God healed them. And so for me, again, the weekend, it was really just like they really took care of you, all the food, everything. It was a great experience, and I was just with a bunch of other people who were singles and, really positive people. And I remember we did one activity, and it was specifically around forgiveness, so that I had to either ask for God to forgive me or for me to forgive someone else. And so I did both. And I wrote a letter to God from myself asking for forgiveness, and I bawled. I bawled. I think I went through an entire box of tissues. I mean, I just was like a mess. And, just it just like really opened up a can of worms, which was definitely a good can of worms, because I just kind of like it just was gushing. And so, and then I wrote a letter to my another ex. This is a different one, who had hurt me, though not, again, not that way. He had cheated on me, and then left me for another woman. And so I forgave him, and I was like, you can ask God for forgiveness, he'll forgive you and all that. And I remember that he actually wrote back to me and he said, I've been doing, kind of I actually sent that letter, and we didn't have to, but I wanted to. And he said he's been kind of doing some searching. And he wanted to talk to me. And I was like, yeah, no, not a good idea. And I wasn't in a place, to even have that conversation. I was not strong enough. And but during that time, I really made the decision that I wanted to become celibate again. And I just was like, I just need to focus on my 100% my own healing. And I wasn't fully aware of how my mental health issues were impacting me at this time. And this is, again, I was 33. It still had been drinking. I had done maybe a little bit of coke here and there. And, I wasn't, I wasn't going nuts, but I wasn't in a great place. And so, when I made that decision, that was huge. And just like immediately, I felt like I was a totally different person, like just from making that one decision, and just from forgiving myself was just huge, and feeling that God really forgave me just opened up like so much freedom for me. And then I also kind of started doing some meditation as well. And wanted to make a decision. I just kind of make a decision. I'm like, I'm just kind of curious. Maybe I should stop drinking. We'll see what happens from that, see how it works, and see if I could do it. And so I did. And I actually had an entire 7 years of just, again, just not a drop, and really, really focus on my healing. I wasn't an alcoholic. It was just more of, it was something, I drank on weekends, and just socially, it's just that I kind of felt that was something that I needed to do. And so I did that. And that was, again, unbelievable in a different way, because, and then from also the retreat, I also made the decision that I felt more worthy to actually live back home near my family. So I made the decision, and within a year, I moved back home to Pennsylvania, which is where I've been since 1999 now. So 24 years that I've been back in PA. But again, it was because of all that I felt like I was worthy to be with my family, because I felt like I was the black sheep. There was something wrong with me and my family, that the rest of my family was awesome and I was messed up. And I just didn't want them to know it. And so I felt like I had to hide it from them. And so that's kind of what I did. And now I felt like, ooh, I'm actually ready to go back home. And so made that decision.
So, I have a question. So, and I know it wasn't a heavy period, but what introduced you to Coke, and how long were you on it? Was it to suppress the pain that you were going
Mm.
through? And if so, I would like to know, did someone introduce you to the drug?
Yeah, actually. So when I was in school in San Francisco, it was actually some friends of mine introduced me to it. And I didn't, you know, luckily I was just so afraid of drugs that I was really cautious about doing anything at all. And so I did just a teeny bit. And so it actually kind of helped me to focus. And I realized, so kind of forward many years, I actually have been diagnosed with ADHD and didn't realize. So Coke actually made me feel better, and it calmed me down, and actually I was able to kind of focus. So it almost acted like, an ADHD medication for me. And I've heard that people say that, cocaine was that for them, that it kind of did that for them. So, like I said, I didn't do it very often just because I was kind of a poor college student, and just never really. Then when I was making money, I just didn't. I don't think I ever actually spent money on Coke. Thank God. Like, it was only that the only way I ever got it was people just giving it to me. So, again, obviously, I know lots of people that's bad and that's enough. But luckily, I never spent any money, so that was a good thing.
Yeah, that's definitely a separation,
Mhm.
of the kind of spectrum of use there. So completely understand. Did you have any moments in college, that kind of shaped your kind of need to know that you needed some healing or some work on yourself? Did you, have any specific experiences while in college in California? I know you all the way across the country. Like, what was that like?
Yeah. Yeah. I mean, just being in, what I was actually, my undergrad degree is in physical therapy. So I was in kind of the physical healing. And with that, I think I didn't have a whole lot of realization at that time. But when I was in Florida, I started getting my master's in special education. And I also was working with these girls who had developmental disabilities, and they had behavior problems. And so I worked with a variety of different kids with behavior problems, and I really realized that I got them, and I felt like I was naturally good at managing people with behavior problems. I think because I had so much empathy for them and I can relate to them, even though I didn't have a whole lot of major outward problem behaviors. Like, I was definitely not kind of outwardly rebellious and having lots of angry, aggressive behaviors. I was much more of an internalizer, and I directed it toward myself, but I still understood the kids. And so from that, and I also met a behavior analyst who I'd never even heard of them before. And through that work, I I'm like, oh my gosh, this is what I want to do. Cause I had been working, with athletes and in schools, and, it was great working. I worked with a lot of athletes, and that just being in that world kind of really, especially as a decent looking straight female, like, you were kind of raw meat to the athletes. It's like you had to really, even if it's like ponytail, t-shirt, like, it's not like I was trying to be attractive. It just is, it was a bad, um, I had lots of very good experiences, but just the culture in general, when I was exposed to kind of that special education population, I just fell in love with them. And so those are probably the things. And then I got my master's, and then I actually moved back to I moved back to Pennsylvania and got my master's at Lehigh University in Bethlehem, in special education. And just absolutely that, again, was kind of a major shift. So.
Okay. So you had a harder time with the athletic side. So a
Mm,
lot of the younger kids are flirtatious, I'm assuming,
yeah.
and it's a trigger. I mean, I guess they're pushing towards the adults because we see a lot of situations like that. And by a blessing, you've never been in that situation, but
Mhm.
I can see the folks don't tell that side of how the athletes are the aggressors towards adults.
Yeah, date rape and, it's and the guy that raped me was a former football player, and, it's the macho, chauvinistic culture. Even now, women are just finally getting jobs working in, high, like in professional sports. Yet for years, that's why I really got out of it, because I was an athletic trainer and I really loved working out in the field. But the only, really the jobs were going to be working in a high school or like a junior college with long hours and not great pay. And I just was like, yeah, I couldn't see myself having a family and living kind of that life, because a lot of it was nights and weekends, and it wasn't conducive to something, that I thought would be long term for me. So yeah, but athletes can be, and they're more likely to get away with things. Again, things have changed, but it's a culture that's been there forever. So it's tough, and I just was like, I needed to get out of it, because I just knew I wasn't strong enough to stay in that. And I just couldn't. I needed to get out of it. So it was all kind of perfect timing, because the retreat happened, and then, again, it just everything happened perfectly. So
Yeah. And when you, I guess, went back to Pennsylvania,
mhm,
and pretty much you said that you felt like, that was your time where you would feel comfortable around your family, like you feel like you fit
mhm,
in your family. What was, I guess, their kind of feedback with, at that point you had been through some therapy, you did your own,
mhm,
your years of soul searching. Were they, receptive to things that maybe you
mhm,
were trying to give or to implement? And,
mhm.
was your kind of gauge of, hey, I'm ready to be home, did that correlate with on their side as well?
Yeah, yeah, it's funny that you say that. So I moved home, and it was, again, I've already had several probably months of not drinking when I moved home, and I was getting ready to go, and I bought a house. I had a job that was paying for my schooling, and I got another job kind of part-time to supplement that. And I had sold a business in Florida, so I had a good amount of money that helped me get my down payment on my house. So like a lot of things that really were positive happened. And so when, again, I had all these things going on. I was getting my master's at Lehigh, and for Thanksgiving, so this is a couple months after I moved there, I was driving down to my brother's, and I was excited. I was going to see my family, being home for Thanksgiving. It was awesome. And as I was driving, I started having a panic attack, and I'm like, what the heck? And for me, it was God saying, I can still hear it so clearly. You've tried to do this on your own your entire life. Now it's time to do it with my help and professional help. So, I didn't really say anything to my family. So this was kind of just the beginning of this whole journey. And then I went to my primary care doctor, and he diagnosed me with generalized anxiety disorder and put me on kind of, I can't remember exactly what it was, maybe Zoloft or something like that, but kind of a low dose of a medication. And that really helped. And then I started going to counseling. So I really started doing all of that. Though again, I really had focused on my spiritual healing, and I did a marathon, I was doing triathlons, like I was eating well. I was like really, I was doing well. So my family was, uh, you know, very happy to see me doing so well. And I tried to spend more time with my nieces and nephews. Like I wanted to make up for living away for so many years. And so my family was very happy. Again, I didn't get into really talking about things in depth with them, but I did had some conversations, and I told them, I said, I'm, getting counseling. And then also around the same time, several months later, I ended up getting diagnosed with lupus and Sjogren's syndrome, two autoimmune diseases, systemic lupus. And, again, I remember thinking, like, what caused this? And what immediately popped into my head was the car accident. And I don't even know why that I did, but it was kind of like, all right, I had the genetic factors, but something environmental triggered it, and trauma can be something that triggers it. So, as the years went on and I did kind of ask more questions, I usually was asking more questions of like my oldest sister, who she and I are really close. Really, I've been close to all of my sisters, but my oldest sister and I were pretty close, and she was the nurse, and she's very comfortable in talking about it. So I would ask her a lot of things. And my youngest sister didn't remember a whole lot from it. She was only 8 years older than me. Some other siblings, I may have asked them little things, just kind of out of curiosity to see what what their experiences were. So I was kind of just dipping my toes in there to ask them, but they were, again, luckily my dad had already passed away a few years after that. And actually he and I had some conversations, and he and I had really made peace. And so I felt like he and I had a good relationship, and I did forgive him. Again, I didn't blame him for the car accident. He blamed himself. And I know how much that really tortured him. So, and my mom, was okay with having some conversations, and, she would tell me stuff too. So generally, I think my family was happy to see that I was doing as well as I was. So that was a positive. Yeah.
Yeah, that's good to hear. Because you took one of my questions I was going to ask. Did you and your dad have a conversation?
Mm-hmm.
So you answered that and that
Yeah.
one. I was going to ask, did the doctors ever tell you why you were having the panic attacks? I know anxiety plays a part, but
Mm-hmm.
they were coming at different moments
Mm-hmm.
unexpectedly. So I just wonder if they said some of the causes behind that.
Yeah. At the time, I didn't, so again, this was 1990, probably about 2000, actually, when I started having some of these conversations and really kind of opening up the healing. And I didn't actually see a psychiatrist or anything. I only saw my primary care. And again, I was doing well. It wasn't until I moved back, actually, I got a job closer to where I grew up. And so, and I'd finished my schooling, and I was in the Lehigh Valley area for 6 years, and then ended up moving back home. And it wasn't until, so I met my husband when I was 40. I just turned 40. And it wasn't until after he and I had a relationship. And, again, I felt like I was worthy to be in a relationship, and I felt like I deserved a better relationship. And so things started coming up. And I actually was officially diagnosed in 2014 with PTSD, ADHD, the combined type, um, generalized anxiety, and social anxiety, which I was kind of surprised about that one, but it made sense because if I ever felt like I was going to have a panic attack, I wouldn't go somewhere. So it was not debilitating, but it was, again, a little bit more subtle. So the doctors, it really wasn't until much later. So again, we're talking 9 years ago. So I was 48 when I was officially diagnosed with PTSD, with all of those things. And the only reason that even happened was because the ADHD symptoms, my husband, I was going, oh my gosh, you have ADHD. And so I was kind of just researching adult ADHD. And as I was reading the the things, I'm going, oh my gosh, this is me. And I really hadn't realized it. And I was never, diagnosed. And so I went to a friend of ours referred me to University of Pennsylvania Adult ADHD Center. And I go, I need a like full on evaluation because I just feel like until I get that, I'm not going to get the best treatment. I need to have a good evaluation. So they did a full evaluation, and that's when I was officially diagnosed. So again, long after all these things happened that I finally got, officially diagnosed. And then also that's kind of when I actually started with a psychiatrist. I was just using my primary care. So, I'm really an advocate to push people to go to see a psychologist, or somebody to get a good evaluation, like a comprehensive evaluation, and go to a psychiatrist, because your primary care, they're just not trained in that, and they may have some skills, but it just isn't. To me, I feel like you need to get an accurate diagnosis, kind of like if you have cancer, you want to get an accurate diagnosis so you're taking the right medication. It's the same thing with mental health issues. We don't do that though. And it's still just, it's a struggle because there's still so much stigma. So yeah, they didn't really say much about the panic attacks again until I went to University of Pennsylvania. So.
Did the accident cause you to have your own issues with driving, since it happened, before you actually learned to drive yourself?
Yeah. I love to drive. I am definitely more comfortable if I'm driving, especially in a city where there's more traffic. And actually, we just came back from Virginia, and sometimes my husband will get too close to the back of a car. If he gets too close, I'm like, gotta stop, gotta back up, and I can feel myself getting anxious, but he understands why I'm like that. And, again, it's not horrible. It's just like, okay, getting a little bit too close. But so I'm a little bit more uncomfortable if I'm a passenger. But even that, like my husband actually drove the entire way. And I was fine. There were only, a few little times that I was like, whoa, back up a little bit. And he's like, yeah, I know. I remember now, because it just forgets sometimes. And because we don't drive in the city as much. And so, so it's, again, not a big deal. And my reactions obviously are way less than what they would have been. But I love to drive. And I've only owned 2 automatics in my entire life. And one was because I tore my ACL and I couldn't drive stick. And the other one was my husband finally talked me into getting an automatic. And so I loved kind of, I think, just being in more control. I think that's part of what it was, is I was more in control of the car in some ways. But yeah, I haven't amazingly had any issues with driving. I love to drive, for the most part. I'm fine even being a passenger. So yeah, thank God.
But it still traumatized you up until an adult.
Oh yeah, absolutely. Yeah, for sure.
Okay, so I was going to ask, so now you're doing amazing work from the educational piece of it with the trauma piece of it. And it looks like you like working more with mental health kids in that aspect of it. Is there a reason? Are they easier to work with, or it's just the passion and love for a special needs child?
Yeah, it's definitely the passion and love, because they are more challenging. And, again, I naturally have had some good skills with kids with behavior problems. So, and I'm pretty patient. So I think that kind of made me a good candidate to work with some of the most challenging kids. So I have worked with kids with autism and kids with, I hate the term, but it's emotional disturbance. And that's the classification in special education. And those are just, again, those are often the ones that are some of the most difficult. And I've had the crap beat out of me at different times. I've been scratched, bitten, that all kinds of things happen. And I understand, I don't take it personally. So I love working with the population. And then I ended up getting a job, after working more directly in teaching. I ended up getting a job at the state here in Pennsylvania doing training and coaching in schools. And I was working in the areas of autism and behavior. And so between all of those, I was learning a lot, and I was really working with teachers. I was kind of naturally good at training, doing training as well. Like I had my bosses when I was working, had me do trainings for others, for teachers and for, other behavior specialists and stuff like that. And so that naturally led me to want to do more of that. And then I also taught in higher education as well. But more recently, I was a state project director for Safe Schools, Healthy Students, which was a big grant that came out of the Sandy Hook and the Columbine shootings. And within that, we did a lot of work around trauma. We actually piloted these modules that came out of the U.S. Department of Education through the National Center for Safe and Supportive Learning Environments. We piloted them in Pennsylvania, and I was just like, I just attached to that, like, oh my gosh, this is what I need to be doing, and I need to share my story more. And so that grant ended in 2018. And then there was another grant for a year that I was a state project director for as well. And then for the last 5 years, I've had my own business, and I've been doing that because, working at the state, it was great to be able to do a lot of this work. But what I really saw, where the changes happened was when I was working directly with the schools. So the schools that I had worked with, we met every single one of our goals that we had. Like it was a huge grant. And so it just was really empowering, and I just learned a lot. And so I wanted to be able to kind of share my story more and really focus on the trauma piece. And because of what my own experiences are, it kind of makes me naturally, I think, more in tune to what needs to happen to create a trauma sensitive school environment and community, and kind of bringing everybody together. And so that's what I've been doing the last 5 years. So that's, it just, when trauma came up and we really started doing the work and looking at it and looking how we can make schools more, feel safer. That was it. I'm like, this is what I was meant to be doing. So that's where I am now.
That's great. That's wonderful.
Yeah.
Just to help our viewers out here, I know the word or the term high functioning is not really socially accepted now, but for people that maybe have children or even themselves, that they're able to kind of move through life just thinking, they just move through life normally, they're able to work, they maybe have degrees, there's nothing that they know is sincerely wrong, but they know something is sincerely wrong. What are the kind of, I guess, characteristics to watch out for, or things that you can notice in yourself to maybe notice you might need a added layer of help here?
Yeah. I think one of the first things is, one thing that's come out of trauma awareness is it's a shift. It's kind of a lens of looking at things not as what's wrong with you, but what happened to you. So that kind of helping me to forgive myself was probably one of the first things that shifted me to look at me, look at who I was. So it's kind of that awareness, but it's also, I think, looking at our patterns. If we're struggling in relationships, it can't, we don't have control of other people. We can only control ourselves. So, if ever I have any issues with anything or anyone, I'm like, okay, if I focus on trying to change the people around me, I'm not going to be very successful, again, because I've learned this. And so I have to make sure that I'm not looking at myself like I'm a bad person. I have to kind of shift my mindset, because if I look at myself as a bad person versus I'm just somebody who made a mistake, it's easier for me to forgive myself and then make changes if I only have like just some guilt. If it's shame, it's paralyzing. And that's what happened to me for all those years, is the shame was just too paralyzing. I couldn't do anything. And so I think it just like there were it was kind of the perfect storm for me. I think that's the big thing though, is to look at, do you have physical illnesses? That was a huge thing too, because I ended up with these. I'm like, where the heck are these coming from? So physical illness, even if it's pain or, because our mental health impacts our physical body. So if we're having struggles with relationships, we're having struggles with finances, or physical illnesses that keep happening, if we're having trouble with work, it's hard again because we want to just look outward. But if we look at it again in that, what, I've had a lot happen to me. And, even if it's kind of chemically mental illness, there are still a lot of things that triggered those things. And so having that awareness of ourselves is really one of the first, and it's hard. That's hard, though. You want to talk to people who are safe for you, like, and that's why I recommend to go to a professional counselor, because a lot of times if we talk to our family members or our friends, they don't necessarily know how to talk to us, and they may inadvertently make it worse. So I always just recommend go to a counselor, and I'll do that in a second. If I'm like struggling with anything, if we've had a lot of stress going on, especially after losing my nephew, I'm like, oh, you know what? I think I'm gonna go back to counseling for a little bit. I can use it, and there's no shame in it. I'm not concerned about what everybody else thinks. I'm focused on how can I be my best, and again, that's a huge shift. Whereas I used to worry about what everybody thought about me. Now I'm like, yes, I would be great for people to like me or whatever, but I'm really focused on my own healing, because that's what I have control over. So, those are kind of some of the things that I think that, but I always recommend getting professional help, because it really, there's no shame in it, and it's life-changing, can be life-changing.
Yeah, no shame at all. No shame at
Yep,
all. And I
exactly.
can't believe we're at time
I know.
already. So really quick, I want to ask, and then Sid is going to close it out. Um, what is one advice that you can give the audience from
Mm,
healing from childhood traumas and through
mm,
your rape being in
mhm,
adulthood and panic attacks? Like, what is that one thing
mhm.
that can help um
Yeah.
through your healing traumas?
Yeah, again, it's shifting from what's wrong with me to what happened to me, because recognizing that a lot of things can happen to you and it wasn't your fault, and that like the adverse childhood experience study was a huge light bulb for me. And if you Google it and look at that, that I think will help you to realize how much you've really been through, that you it's our normal. That's why it's hard for us to see it. But when we see it kind of more, on paper, it's a survey, there's an incredible video out there, Dr. Nadine Burke Harris, and she talks about the adverse childhood experiences study. Watch that. It's phenomenal.
Perfect. And now we are at the point of our show where we like to do shameless plug. So you do see your banner scrolling across the bottom here. You can let the viewers know where they can contact you, utilize your services, where they can buy your book, or anywhere that you'd like to drive traffic. You go ahead. You got the stage.
Thank you. Yes, my book is on Amazon, and it is Shedding Lies, Living Beyond Childhood Trauma. And I'm also about to launch a monthly resilience circle, and I'm just releasing the Resilient Teacher's Edge. So I've got a lot of things coming up right now, very exciting. But those are some things that, sign up for my email list, because you can keep up with the latest, and lots of new things coming out soon. So thank you so much.
Thank you. It is an honor to have you and continue to doing the amazing work that
Mm,
you're doing and giving back, especially to our youth of need. That
mm,
is very important because there's definitely not enough support in
mhm,
that area. To see you doing tremendous work there and through your traumas
mm,
and your education piece of it is an amazing piece. And I always tell folks, when you have been through traumas and then you're passionately doing it in your work, it makes
mhm.
it's a different outcome
Yeah,
from it. Yeah. So we
yeah.
want to thank you for tuning in to Unfiltered Unspoken. It was an honor having you on our show.
Thanks for having me.
We truly appreciate it. My pleasure. We just want to let the audience know. Thank you for tuning in to Unfiltered Unspoken podcast, where we're going to continue to share life experiences. And if you learn anything from Dr. and Katina Lynn today, it is you go through traumas and seeking professional help is okay. And as you heard her say, she has been through a lot of traumas from childhood streaming into adulthood, and
Mhm,
getting professional help was one of the piece, and utilizing her educational piece to help others was another healing piece for her. And it's okay to face your traumas, and it's
mhm,
okay to seek professional help.
mhm,
And we want to thank you for tuning into Unfiltered Unspoken podcast, where we're going to continue to share life experiences in hopes that someone will connect so that they can start the journey to healing. So hopefully someone will be able to connect to Dr. Ann Katina Lynn. And we want to thank you for tuning in.